Wherever you want, in front of a microphone. Figures. All right, we're back. Oh, we set, Olivia? Okay. We're back. We're changing things around a little bit. Thank you for coming early.
No problem.
We are now on the Office for Aging Services. So we skipped around a little bit, but if you could identify yourselves for the viewing public.
Sure. Dr. Marianne Spanos, I'm the Director of the Office for Aging Services.
Diana Songer, the Accounting Supervisor for Office for Aging Services.
Okay.
So, is there a particular order you want us to go in? Or just review? I have in front of me that our 2024 budget appropriations are up from $5,464,000 to $5,732,000. The revenue also is up from $4,248,000 to $4,513,000. And our local share is relatively unchanged at $1,219,000, up $2,963.
Okay. Your FTEs? Or?
The FTEs, we are asking for an increase of 2 positions. This is mostly to meet the increasing work that we have as the older population is getting older. We need, but there were a couple changes in our FTEs. One is a case manager, again, to reduce the wait list. Our health education aide, this is a required position. We tried to RFP this and get a consultant to do it, and we're unable to successfully recruit anybody. That, along with our SNAP grant, we made some changes that we hope will fully cover that. Well, they will fully cover that as a full-time position. And just wanted you to know that we're looking. We had 2 clerk 2s at 0.98 and 1 account clerk. So overall, it's a 2-position change. Now, Chairman Shagnon wanted to know about unfilled positions. This year last month, we recruited a new case manager. The same day, one of our case managers left. So that's, an unfilled position, but we are actively recruiting for that. The health educator, we are also actively recruiting. We're waiting on HR to get that posted, but it's been in the hopper for the last 3 months when we got no responses from the RFP. Our account clerk, we have rearranged some duties. We've been without a payroll clerk. Well, actually, I should say we hire somebody and then we lose somebody. We hire somebody and lose somebody. So over the summer, we did hire a temporary person, a college student who's been doing a fantastic job at doing part of that position. We reallocated the rest to other staff and upped their hours a bit. But we still need that position, or it needs to go to, in the fiscal reorg somewhere. So it's in our positions.
So how many open positions do you currently have?
2, 3, 4, I would say.
And all are being actively recruited?
All are being actively recruited.
Okay, thank you.
Mm-hmm.
Word travels fast.
I sent out an email to the
That's
department
good.
heads who were gonna be here today. Now, I hope the word travels to the other department heads that are gonna be here later in the week.
I think it will.
Well, we got your email. And we read it.
Mr. Chairman,
Yes.
Mary Ann, so these two new positions, 100% funded, is that through a grant or is that just through your regular state or federal aid funding?
Yeah, it's pretty much the case manager and the health educator. Yes, we have.
Through a
well,
grant?
I don't know if you could say it's regular funding. We have had the SNAP grant. It renews itself every 5 years.
Okay.
We're in the second 5 years. It hasn't gone away yet. We are farming out some of that work to Cat and Allegheny County. Remember, you passed a resolution a couple months ago so we could contract with them for part of the work that's done in their counties, but we're still doing some of that work in our county. So half of this person would be under the SNAP grant and half would be under our regular Older Americans Act. We get a pot of 3D funding for health and wellness.
Yeah, I guess my concern is just when the funding runs out, how are we going to?
Then you eliminate the position. I mean, if it did run
Well,
out.
No, I agree with you,
Mm-hmm.
but for the time being, the SNAP grant has been renewed,
Yes, it was
Okay.
just renewed for another 5
and
years.
that funds these positions.
Yes,
Well,
that will
okay,
fund that one position. The
Partially.
other is our case manager. All of that's regular funding, either state or federal.
Okay.
You can't put more older adults on our home care program if you don't have a case manager to manage that,
Okay.
you know.
All right, thanks.
Sure.
One more question.
Sure.
If I may.
Absolutely.
The retention issue, you say you hire one, you lose one. Just in a small paragraph, why? Are they going to a comparable job, more paid, don't like the job, don't?
Some is, yeah, it's hard to say. With the account clerk, we had hired an older gentleman who was retired, and he took a job in another state. I don't even know, he was barely here a month, so I don't know what to say about that. The case managers, they're just moving around the county. We had one case manager go from our work to the youth bureau. We've, I'm sure, recruited people away from Department of Social Services. So we're trying to beat the bushes ourselves too, to let people know that these positions are out there and available, because we don't want to be recruiting people from another department. But we have a different population, so if they're not happy with the population that they're serving, some people have come to us and say, I'd rather work with older people. I don't want to work with whatever their population is that they're working with. So, I mean, I never wanted to do kids when I was a PT. I liked working with older people, So I'm sure some of that's going on. It's not so much salaries, I think, with the case managers. Does that help? I guess I will say, that, for me as the Office for Aging, I do feel that older people who want to work beyond part-time, it's very difficult to enter the county system. They're competing amongst a lot of younger people. The civil service test is daunting for them. That's not your problem, but there are a lot of older people who want to work beyond 65, just because they want to keep active, keep their mind involved. Some of them have great skills, and they just want to do something that's a little less I don't know, challenging than what they used to do. And to hire them as even a full-time clerk to be in our front office, that test can be a barrier. So,
Thank you. I just asked the question. It's been an ongoing
Yeah.
county-wide
Yeah.
issue for several years, so thank you.
yeah. So the next page I have in front of me is the tentative budget summary. You will see that we had some significant increases in payroll and benefits, but we were able to absorb that. Our increasing vendor costs. There's so many things. We do a lot in the food industry with our home delivered and congregate meals. So food costs are up. That means that we have to spend more on those contracts. And gas is up. We have to pay more to have that delivered to people's homes. We've had to increase, in order to recruit home care aides, we've had to add significant money to those contracts so that the home care agencies can recruit and retain home care aides. So, but we have, the revenue to offset that.
That's not increasing services, keeping the services the same. The level.
So, we still have money to spend in services. It's been a challenge. We've spent it on different services because we haven't been able to get the home care aides. So we did a lot of home repairs this year. So we kind of moved the services around. We're really whittling down people who need access to home and home repairs. But at some point, we may need to transition that back over to in-home care services. Does that make sense? So we'll spend it wherever we can. It still helps people.
I guess my question was the increase in the expenses, like you mentioned food, delivery stuff, but that's just because of the costs are higher. It's not because the level of services are going up, you're
Some of that,
maintaining-
yeah, we're maintaining the current level of services, and we are flush with money this year. Still, we have ARPA funds that we are putting into these services. So those are gonna sunset in 2024. I'm hoping that our advocacy with the state and the federal government will keep our funding high. But that is a concern across the board, is what happens when all these funds sunset in September of 2024. So the Older Americans Act is up for reauthorization next year. Every year, we're doing great with our advocacy on the state level and have been able to get more funding from the state. What we've done in the past is, if that money isn't there in 2025, is cut back on services.
How much is that?
How much is the ARPA funds? How much did we allocate? It was 500 in total, right?
Yeah.
It's a couple $100,000. So then we can't give as much services. But as I said, I'm hoping our advocacy efforts will prevail there.
Hopefully the good will be seen and they'll come up with the funding in a different way, yeah.
Well, a lot of our federal funds really stagnated since 2010. The state has put in a lot more money. And across New York State, most local governments are putting in the biggest pot of money, did you know that, into aging services. Second is the state, and third is the federal government, which is really the reverse of what it should be, right? But we are in the federal budget, we are in that discretionary non-defense section of the budget. So that's the only thing that the Congress really votes on, is the discretionary part of the budget, right? So, and when they don't want to touch or they increase defense spending, then they have to take it from somewhere. And if they're not wanting to have the will to tackle any of the mandated programs, which is a huge part of the federal budget, but we've been, again, successful in that too.
What are the demographics? I mean, Chautauqua County is.
Right now, we're 25%. I think the rest of the country might be at 19%. I didn't look at that today. We're 35,000 older adults, the last numbers I have, over the age of 60, and a little under 129,000, or right around 129,000.
And that's trending.
That's still trending up. Yeah, probably for the next 20 years, 20 more years. And people are living longer, too. You know, we used to not see people have a 100-year birthday, and now that's not uncommon.
Anything else on 6772? Okay.
Okay.
Marty, I've got some questions as far as line items for this department.
Sure.
Folks, some of your contractual expenses have gone up a lot, especially will care. Okay, and this is, I don't know if you have it, page 4 of
Yep,
6.
I know that one exactly because,
Could you
so-
address that?
Sure.
Okay.
Sure. You know, when we budget, it's really hard to say which of the agencies is going to utilize the money, but we have 2 contracts with WellCare. One is to act as a fiscal intermediary for, you've heard about the consumer-directed home care program? So,
Okay.
yeah, on the TV, you'll see you can hire your granddaughter to do your care, right? For the Medicaid program? Oh,
She's only 5, but, okay, but that's okay.
But most people are familiar with that. It's called consumer directed. It means that you can hire who you want and you have an agency act as the employer of record or the
Okay.
fiscal intermediary. We had another party doing that for us and they opted out. And so WellCare has taken over a lot of that work. We also are bringing on another party, but we budgeted it all in WellCare.
Okay.
So it looks
this-
like they're
I
getting it
mean,
all.
We're talking about an actual amount for WellCare for 2023 is for 44,000, but next year 165. But you're talking about that some of this was paid for by another agency or another
No, it's
provider?
paid for by us, but it's to have WellCare have these. So if my mother hires me, okay, under our program, they qualify for our program, but she wants me to be paid to give her care. I would sign up for WellCare. I would provide WellCare with all the proof that I did the actual work, and they would pay me as a fiscal intermediary.
No, Mayor, I get that.
Okay.
What I having trouble understanding is it's 44,000 for, well, you know what, actually, this is for the first 6 months, so it'd be 88,000 probably for this year, and it's 165,000 for next year budgeted.
Right.
It's doubling.
Because
Okay.
we moved over that whole program to WellCare.
Okay, that's what I was getting at.
And it may not all go to them, it's just, we didn't have the second fiscal intermediary
This is
on
where you
board. This is where we
you've
budgeted it.
Okay, all right.
Mhm.
Okay.
Because they were our only fiscal intermediary when we were doing the budget.
Okay,
So Terry, if you look 2 lines up from the will care line, you'll see that last year, the trusted nurse staffing, PC2,
Yep, exactly.
was at 236,000, and that's gone down by 166,000.
to
And
70,000.
so now will care has gone up by 162,000.
Okay.
Right.
That's what I was trying to understand
Sorry.
there. Okay, that makes a lot more sense. Thank you.
Sure. Anything else on the line items?
Any other? Okay. Guess that's it. Thank you.
Sure. Thank you so much.
You're welcome. Thank you.
Chair, thank you. That's what I was trying to get at, is where's that increase coming from? They had a decrease in that trust nurse thing. Okay, but she didn't mention.
I know. That's why I jumped in.
I was expecting her to say that.
Clarifies it. I felt better. You didn't care, Scott.
Hey, it didn't say we care, it said we care. Actually, it's not will care, it's we will care. Your granddaughter started taking care. That's how they call it, y'all care.
Anybody else coming?
Veterans Agency, probably 1 o'clock.
4 days
I
of
have time to go downstairs and get a coffee.
everything y'all.
Yeah.
Y'all going out to dinner?
Did you see that for curry?
Y'all getting up?
Not a coffee.
Now, did you give them a hard time and say who? Exactly.
Until you're not.
Until I'm not allowed to
Oh, I gotcha.
eat a lot, drink, eat, whatever, a lot of caffeine.
I just keep telling them, speaking.
Well, they put in a curry, give them break roaches,
I did.
so you get a fresh cup.
There you go. That's what I, just to get decaf.
I'll be right back then.
Okay.
I
Yeah,
should
break
be.
right over there, and Dr. Falk's coming at 1:15.
Oh, you?
What?
Oh, I didn't even, oh, well, better, no, Greg's here, so.
Oh,
Greg
Greg.
said
Yeah.
that. Yeah, sure.
Oh, he is. Hi, Greg.
Early is good. Early is good.
Early is on time. Doing something embarrassing.
Which one do I sit in the middle?
Wherever you would like.
Sit in the middle, that way I
You
can
have a microphone.
defend my shots easily.
Okay. If you could identify yourself for the viewing public.
I am Greg Carlson. I am the Director of Veteran Services for Chautauqua County.
Okay.
And Greg, I'm sure you probably already know this because it's not your first rodeo, but all you need to do really is just walk through your summary first.
Okay.
And then the committee will ask questions after you do your presentation based on your summary.
Okay. Honestly, I can do this about as simply as possible because we don't have very many changes from year to year. We do have one fairly significant change this year, and that is for our personnel services. We are adding half of an FTE for our administrative aide. And this was something probably 6 or 7 years ago. Office for the Aging and the Veteran Service Agency were co-located. We received a grant, and OFA and the Veteran Service Agency was sharing our administrative aid. And then when we received this grant to help both agencies out, we had the grant cover half of hers. Fast forward till now, we're no longer co-located with Office for the Aging, and it's time to take back that other half of the FTE. Beyond that, we have no significant changes other than what we would have from year to year, which would be, minor increases for supplies, or this year we have, we're not purchasing IT equipment as compared to last year, so there's a little reduction there. And I'll open up to questions unless somebody has. We're very simple.
Greg, if you would.
Okay.
Do you have any open positions currently?
Yeah, and we have no open positions.
Thank you.
We have a total of four, a four-person department, well, five, but one is funded by a grant. The Director of Veteran Services, a service officer in Dunkirk, a service officer in Jamestown, and our administrative aide. And that has not changed since 1972. I have no idea, but it's been a long time. As long as I've been here, that's been everything we have.
Thank you. And this is a point for the Budget Director, that this shows an increase in the partial allocation back from OFA, but the OFA FTE count doesn't reflect that reduction.
Well, I guess I would say that their net, OFA's net increase really would be, they must have had some other reduction for them to have a net change in two positions.
I do believe on the summary for the OFA, if you read on one of them, they do combine two positions at a .98 decrease. So one of those positions, I believe, is the one that is going over to the veterans.
Well, it should be a decrease. It's a 0.9 increase
it's
on
an
OFA.
increase, yeah.
It should be a decrease if it's going to Veteran Services.
Yes, it should be a decrease. That's a typo, I think.
Well, perhaps you could get us clarification on that. And
Oh, no,
I
it's not.
apologize because the order of the departments, I was planning on bringing this up with Greg before the OFA budget review, and
Yep.
it's got reversed.
Huh.
So if you can just get us some clarification on that, that would be helpful.
Yes,
I think it most likely is her notes don't reflect all of the changes that occurred, but the figures, the numbers on the report are based on a report out of the system of the total FTEs. So we'll get a full reconciliation for you.
Thank you. Sorry, Greg.
Oh, no, don't be. And that there could also be a little bit of confusion because the grant had been paying that half FTE for several years, so it wasn't like just a change from this last year. It's probably been on the books for, I'm just guessing, by the way.
Okay.
So, and just to be clear, that person, you still have that person?
Absolutely.
You're just paying for them
Correct.
yourself
So-
out of your own budget?
So back in 2000, I believe it was 17, it might have been 18, but I believe it was 2017, we shared the administrative aid.
Are you still sharing? Do you just-
No. So at that time, we were co-located, we
Right.
shared the administrative aid, we received a grant. It took a long time for that grant to hire a new person and all the things that go along with that. So we had a big surplus of money with the grant. So we made an arrangement to help everybody out. We would have that grant pay half the FTE, that made some room for OFA, understanding that eventually it's gonna come back. And, but when, we're no longer co-located. So we picked up that half FTE from OFA, and now we're paying the full amount. So it's overall the same amount, it's just, well,
You didn't really gain anybody.
no, we didn't gain
Just
anybody.
gained
We just,
paying for a little
we just gained a little bit more expense.
But now you're not sharing either,
No, correct, we're not sharing.
so you gained a little.
Oh, yeah, well, yeah.
Okay. So now OFA has an administrative aid and you have an administrative aid, as where prior to the grant they didn't.
I don't know about that, but I know,
Oh.
I know that we've always had the same person. And, but she did some stuff for OFA when we were co-located, and no longer does that. She's all veterans.
Any other questions? Okay.
Is that it?
I guess that-
Jeez, my budget just doesn't impress anybody. I don't know what's wrong with
can't believe the legislator Nebel didn't ask how the van was doing.
I was curious, how is the van doing?
The van is doing well, and this could lead into a whole nother subject of conversations, but according to carts, the van probably has about 18 months of shelf life left. So we have it budgeted through 2024. To replace that van, in today's money, would be between $150,000 and $200,000. We are down to probably 2 to 5 riders per week. So once upon a time, when we still had 16 million World War II veterans worldwide, and our fair share of those here in Chautauqua County, or Korean War veterans, the veterans van was used Monday through Friday, and it went to both Erie and Buffalo, and it was full every day. As time has progressed, ridership has gotten less and less and less, till now where we go twice a week, and we might have 2 or 3 riders, and they're kind of always the same riders who are going twice a week. So we've talked to carts, and there is a possibility that just because it doesn't make sense to have that big of an expense, that the veterans van may cease after 2024.
Greg, possibly, but if you're looking ahead, there's also the Vietnam veterans that'll be coming up too, so possibly you might have more use from them. Because there's a, 14, 15-year difference between the Korean War and the Vietnam War, so.
Possibly, we haven't seen that, but
Not
possibly.
yet, but you could.
But we could, yeah. And then it comes down to a matter of dollars and cents, and that is,
Understood.
are we spending hundreds of thousands? Because the VA, if you have a total combined disability rating of 30% or higher, the VA does reimburse your travel. So, yeah, that's one of those things too. And a lot of the Vietnam veterans, as opposed to the World War II and Korea, because of the Agent Orange, have that higher disability rating where they do get paid mileage and they tend to find their own transportation. Doesn't mean that's,
Oh, I see. Okay.
yeah. So that's, I think, why we don't see the Vietnam veterans
You don't
riding.
see the increase.
Correct, because they typically have compensation for the Agent Orange exposed illnesses, and they get paid mileage. That's not universal, but as a trend.
Thanks.
Okay.
How much have you saved toward a new van?
Well, so the Community Foundation kind of handles that side of it, and I have to look at the numbers, but nowhere near enough to purchase a new van. So we don't have $150,000 to $200,000. So one of the things we were talking about doing is using the money that has gone toward the van to offset the costs of operations and maintenance, and also match the wraps that CART has done for the other vans, to make good use of the money that we do have, because it's not going to be enough for a new van, but it can be enough to keep the van we have going for possibly longer than it would otherwise, if we put it toward the maintenance, towards some upgrades and everything, to try to maybe extend it out a year or so. But as it stands right now, with no big upgrades, they say it's got about 18 months. Because it's every year the maintenance gets more and more and more as the van gets older and older and older. All right. Thanks.
Thank you.
Enjoy the rest of your day.
Thank you.
Good question, Terry.
Are you sure that's the position he's talking about though? Okay.
Go Bills.
That was part of the choir program?
Go Bills.
Oh, so it was, but who's 60? Oh, it was going to mental hygiene. But he must be thinking about another position though, because they did have a shared position before between veterans and OFA.
Mostly to Buffalo.
Jamestown.
Mostly to Buffalo.
Only to Buffalo. And then we use it also for, like, people will call and request for Veterans Day, or when we take the honor flights to Buffalo.
Okay.
So we use it for some of those other things, but that's 2 or 3 times a year.
Yes, substitute. That's the one.
So, so, yeah, Carrie was, okay, so Carrie was split, mental hygiene. But was it somebody in OFA that was allocated to? No, Cindy, Michael. Deal, no, she's all,
No, but I mean.
oh, all of Cindy is, yeah, is under the Dwyer program, so.
Oh, I've got a sick kid at home. And I've got a niece who's going to get induced to.
What? Okay, we're going to take a 15-minute break, so be back by 1:15.
Anybody?
All right, let's get back to it. It's 1:17. We are at Public Health now. And thank you to Dr. Falk and his group for coming early. So if you want to come on down. You put chairs in for a reason. Yes, you have to.
Can you scoot down?
Good afternoon. I mentioned to Mr. Nebo this morning that I forgot to send you all the message to make sure you take an extra aspirin this morning and keep those
Yes.
muscles stretching and make sure you don't get a blood clot in your
Yeah,
legs. you know.
circulation, yeah.
Yeah.
Circulation.
I'll think of that for next year. I'll send you some recommendations. The donuts will get you through that, so that's all right.
Uh-oh.
And the candy.
And
There's
Oh.
candy back there too.
Yeah, we'll have to work on some protein items for next year. We'll work. Yeah.
Hamburgers.
Peanuts.
There you go.
So if you all could introduce yourself for our viewing public.
Sure. I'm Dr. Mike Falk, County's Interim Public Health Director and Chief Medical Officer.
I'm Lacey Wilson, Public Health Deputy Director.
Wendy Douglas, Director of Patient Services.
Kathy Burgess, Director of Community Health Nursing.
And I'm Stan Zaffuto, Fiscal Supervisor, under the Finance Department, assigned to Social Services and Public Health.
Just to give you a little extra introduction, Wendy also, she oversees our early intervention program, children with disabilities with special needs ranging in age from 0 to 21, and also oversees our fellowship program and quality management for the health department. Kathy Burgess oversees the public health nurses, the support staff in the public health clinic, the jail clinic, and the MAP program. I certainly can't do my job without these individuals, which is why I've asked them to be part of the team today, providing this presentation, as they know their business very well.
And also just to highlight Jessica Worsley, who is at a conference currently not here with us today. She oversees the Environmental Health Division.
Okay. You just, Jen, if you want to explain.
Yes, Dr. Falk, Sam, whoever, if you would like to start by just walking yourselves through the summary first, and then the committee will in turn ask questions once you finish up based on your summary.
Sure. I've prepared some summary remarks. As you all know, this is our first full budget year, not merged with social services. The health department, as you know, offers various programs and services in order to help prevent disease, protect the public's health, and promote our community's overall health and wellness. The work that we do is almost entirely mandated, and much of it is not funded or underfunded at the state and or federal levels. Unfunded programs include the coroner program, correctional health, including our medication-assisted treatment program, which is soon to be known as the substance abuse recovery program at the Chautauqua County Jail. Many other programs are underfunded, such as our children's programming. We're here today to present the tentative budget summary for the Public Health Department, which will include the coroner program, public health admin, correctional health, also known as the jail clinic, our MAP program, environmental health, our programs involving children with disabilities and or special health needs, otherwise known as education for handicapped children on your budget sheets, and early intervention. In regards to FTEs, the team together made a decision to reduce FTEs in this year's budget by 4. The 4 positions include epidemiology manager, a homemaker position, and 2 nursing positions. Due to the difficulties recruiting 2 nursing positions and because we've not been able to fill the positions for some time, our team has removed them from the 2024 budget. 1 new position is requested, of which is being funded by a reallocation of a previous nurse position that is not included in that 4 FTEs. Also, an engineer FTE was increased by 0.5. We've identified some areas of high risk and headwinds moving into 2024. One is our MAT program, Medication Assisted Treatment Program, which is under the umbrella of the Substance Abuse Recovery Program within Chautauqua County Jail. As you all know, this is an unfunded mandate that came down to us in October 2022. We have budgeted close to $1 million for that program for 2024. Another possible high-risk area that we are always paying very close attention to is our early intervention and preschool education for children with disabilities and special health care needs, especially now coming out of COVID and the unpredictability of changes in enrollment from year to year, as well as contractual costs. Anyway, that is the summary. I certainly don't want to leave out the fact that we are proposing a 14.2% reduction in local share this for 2024. So.
Dr. Falk, could you tell us how many of your positions are currently open, unfilled?
Sure. We currently have 11 positions that are open. Some of them are in the filling process. Half of those positions are licensed positions, either a nurse, most of them nurse positions, so five out of those 11 are nurse positions, 1 engineer position. We have found that it has been very difficult to recruit for nursing positions due to basically a non-competitive wage here at the county. And not to mention difficult work in the incarcerated type of setting. And then the engineer position that we require for a lot of our environmental health things, we just can't seem to recruit due to non-competitive wage. I can go through each of those 11 positions and give you the update if you'd like, but that's kind of where we're at. Several of those are, at least 2 of them are being actively filled at this point in time. We've actually hired a couple people.
Good,
So,
thank you.
Marty, just a quick question on that. Dr. Falk, of those 11 unfilled positions, do you have an active civil service list? Can you hire off the list and just haven't got to those people yet? Or
there's one position, I think it was a public health
aid?
It's an operations assistant through environmental health. The test is being offered on October 7th.
Okay.
And then one of the other positions, I believe the list just came out, and we're waiting to kind of get that filled. So very limited numbers, so maybe 1 or 2 positions that we have.
That you can fill off the civil
Right.
service list?
Right.
And they tend
Okay.
not to be the technical position.
Yeah, and those ones, again, tend not to be the engineer or the nurse positions, yeah.
Thanks, thanks.
Can I just
Yeah.
delve in a little more from that? Do you think you'll kind of typically have 11 positions throughout the year, or, a realistic figure? I know it's been challenging to hire those positions, and I'm sure you always maybe fill that gap a little more, but then some leave, so you're probably always short.
Yeah, the positions that we kind of just took off the plate were the ones I mentioned, that we just, either because of the reassessment of how we're, sort of looking at the framework of the health department, or because we just haven't been able to hire, we took those off immediately. Of the ones that we have, sort of, those 11 positions now, one of them is the coroner director, coroner supervisor position that we've talked about. That one we should be able to fill pretty much immediately in 2024 when that's ready. We have a public health tech and an operations assistant, which we're just waiting for the civil service. Those should be able to be filled pretty quickly. We do have 1 LPN and 1 RN that are hired and scheduled to start within, Kathy, a week or 2?
Correct.
Couple of weeks. So that 11 within the net, by the end of the month, should be down to, 8, 7 or 8. My hope would be. And, my hope is that, these other positions that we've identified that we are optimistic that we'll be able to fill, we just have to somehow get through the challenges of recruitment because of, non-competitive wages, specifically with the nurses. Yeah.
It's probably a pretty close, or it's probably the closest you've been to filling all the holes, really, that I can remember, so that's good. Non-competitive wage is tough. But people have to have a heart and want to help in that particular area, and it's hard to find those all the time, so.
And just so you guys know, we did, this, over the last few months, trying to find solutions to that problem, specifically with the nurses in the correctional health, within the jail. We did recently increase their hours from 35 hours to a 40-hour work week, which I think made some difference at least, so.
Along with that too, if it's all right with you, Dr.
Yeah,
Paul. So Mr. Pavlock, to your point, some of the nurses, and, we'll probably talk about this in a little bit too, within the early intervention program and some of the childhood programs that we offer, the demand is increasing there a bit. So those nurses who would, have the opportunity to maybe slide over and fill in some of those gaps, even they're pressing up to 40 hours a week now with some of their caseload. So whereas, maybe we've stretched some really dedicated nurses before, now we're kind of pressing up to that ceiling.
Mr. Scary?
Yeah, Dr. Falk, what, that non-competitive wage, how far are we off? Hourly, weekly, however?
Probably at least, Kathy, nurses within the medical community right now, the hourly wages being offered to them by hospital settings, or with travel contracts, traveling to different regions. In fact, they get travel contracts without having to travel, unfortunately. Setting those aside, those numbers are just vastly different. They may be $20, $30 an hour different. I think that, we are, Kathy, you'll have to correct me, but, somewhere for a nurse coming into the health department, somewhere in the mid to upper $20, $25, $26 an hour, are we there? Approximately.
Say that again?
The nurses that we're hiring now
Uh-huh.
are coming in at what hourly wage? Somewhere in that 25 to 26.
They're taking pay
Dollar an
cuts to
hour.
come here.
Yeah.
So, yeah, that's
Yeah.
what they're starting at.
We're probably at a minimum of $10 an hour, if not more.
Yeah,
off.
about $10.
And locally with the engineering position, Cummins is hiring non-licensed, out of school, straight out of school engineers, upwards of 70,000, 75, up to 80,000 entry-level non-licensed, which is a big difference from the licensed position that we'd be able to offer.
But we're talking a $25,000 or $30,000 difference for the engineer position.
I assume that some of the changes made to the CSEA contract which won't go into effect until January 1st will help a little at least, but I'm sure there's still a gap even with those increases in the CSEA contract starting next year.
Yeah, because some of the positions are supervisory management level positions that we're hiring for, so.
And this is despite, us, those of us that are working for the county are here because we want to be here. And we stress, so we're trying to get out and providing some education specifically to the nurses of the advantages of county employment, and the important work and the rewarding work that we do in public health and correctional health and that kind of thing. So we recognize it's not all about money, but at the end of the day, people have to put a roof over their head and food on the table. And this is probably something that I'm sure you guys have been hearing at most presentations, and with inflation continuing to go up and costs of everything going up, it's difficult, so.
Which bargaining unit are the nurses in?
6,300.
They're right, that same one.
Okay, anything else? All right, if you could go through each line item here, or
Sure.
each,
Yep, yeah, we can start with the organizational subsets. The first one is organizational A.1185, that is the medical examiners and the coroners. And this does have an increase. We do expect increases in autopsy costs in cases. There is an increase. Obviously, we are adding in a coroner director position as well. And there is no revenue basically for the coroner, so obviously, as he had mentioned, it's an unfunded department or mandate that we have. But realistically, there was an increase based on number of cases and also the new coroner director position that was being added in.
And again, just that position was reallocated from a previous nursing position that we were able to take out of the budget, so similar, should be a similar type of salary and fringe there, so overall, it's, should not be an effect on the budget. And that was not included in those 4 FTEs, that was different, entirely different.
You gave us a nice presentation about that just
Yeah.
recently, and it well explained the need and why we have to do this.
did you do that presentation for audit and control?
Human services and audit control, yeah. Yeah, last committee meetings.
And,
Terry?
Sam, how many coroners do we have? Do we have 5 or 6 now?
So we have
Currently?
6
6.
coroners. All 6 of them are now nurses. All have other jobs, and, yeah.
Okay, and then Doc, this new director position, is that gonna be filled with one of the people we currently have, or is this somebody coming in from the outside?
Yeah, so it will not be an extra coroner. So we're gonna, I think by charter, we can only have 6, so, one of our coroners may be eligible for that position. And, we do have, I would imagine that we'd have a couple of very good candidates for that position. But overall, we will not have any more than 6.
Okay, because it used to be 4, we raised it to 6.
Okay, right. And once we get that supervisor position in, we're still not sure if we're gonna need all 6 necessarily.
Okay.
That whole framework of how we structure that program, we're gonna be looking for opportunities, being that this is, we don't have any revenue coming in for this program. We're gonna look for some unique opportunities to help reduce costs
Good enough.
with this position, so.
Thanks.
Any other questions?
All right, so the next organization is the Public Health Administration, A4010. This does have a reduction in local share. A lot of this is due to the ELC school reopening grant. Was a large grant, it was a large number included in last year's budget. That grant is ending this year, I believe, at the end of this, or last month. So obviously, we're not budgeting for that next year. This also has the personnel for the public health admin. It does have the reduction of FTEs that are also in there. That's kind of where they were housed, wasn't in this department. And then the change in revenue obviously is also based on the change in the ELC COVID reopening grant. With that being gone, obviously we remove that out as well.
Any questions on this? Okay. No.
Yeah, sure. This program specifically is what employees and what's the job?
So the admin personnel?
Just all the administrators?
That's pretty much, it's pretty much everybody, for the most part, other than, we have the nurses, in the correctional health, separate. But all of the other public health nurses, all of the other support staff, pretty much, the administrative, the managers, myself as department head, Lacey as deputy director, that all is within there. some of my, you know, salary and fringe is crosses over to the jail and the MAT program specifically as well. But
And that's also where the employees for the fiscal unit that report to me would also be located.
Okay.
All right, so up next, well, the next two were kind of combined, not together, but we separated the MAT program out of the jail this year to kind of keep them separated. So first, A4017 jail, there is a significant reduction that is moving the MAT out of this program, kind of separating it into its own separate subset of the jail to kind of keep them separated, the funding separated. So when you look at the jail itself, as you'll note, the notes basically are all related to the program expenses for MAT being moved into that other sub-organization.
Question?
Sure. Have you noticed the difference in, with the MAP program being around, or noticed a difference in the jail clinic expenses and the services that it's providing? You know, obviously there's gotta be a line where the MAT starts taking a little away from the jail clinic, I would assume, maybe I'm wrong.
it's hard to keep track of that data, you know, because of the, because we have so many individuals that are coming into the jail and staying there for only days sometimes or a week. So we hope to be able to see, you know, a decrease in recidivism. There's a study out of Kentucky that basically showed that every dollar spent on medication-assisted treatment specifically saves $4 in elsewhere. So in, you know, whether it be incarcerated expenses, you know, crimes in the community, social service related type of things. So our hope is that it is. We just don't have great data. We don't have a great means of collecting that data. We did assign an operations assistant within the MAP program now within the last month. And we have that individual starting to collect and look at some of this data. We want to know that our patients are following up in clinic after release. You know, we want to know, you know, what, you know, if they're coming in on medication, we want to know what their charges are. We want to be able to start identifying some of these pieces of metrics that we can identify and hopefully make some difference in outcome.
And to that point, I think that was a great idea that, you know, born out of Sam's team and finance to splice on paper the MAP programming out for that reason, so that we'll have now a whole year's worth of you know, finance info, line by line separated from the other correctional health, so that we can really look at that.
You know, we're gonna be looking at, you know, $500,000 in expenditures just for medications alone for this program, not even to talk about salary and fringe, this year, 2023. You know, we're always looking at opportunities to streamline our process, you know, in the name of helping to reduce those local tax share, local tax dollars. But we balance that with the need to meet the mandate from New York State, and also the need to take care of these folks that are struggling with this problem. You know, we are proposing, and I want to make it very clear that, you know, number one, the MAT program, the medication-assisted treatment program within the jail, is under the umbrella. It is one facet of treatment within the jail under our umbrella substance abuse recovery program within the Chautauqua County Jail. That was the commission's mandate to us, to establish a substance abuse recovery program. And it also included medication-assisted treatment as one of those facets of treatment. So a lot of these individuals are, may not be treated with medications, but are undergoing some group or individual counseling and therapy while they're incarcerated. That part of it isn't necessarily reflected in our budget. Those personnel are coming from mental hygiene. But there's a big team of people, also including the corrections staff that are participating in this program. So, that is probably going to be or will be reflected somewhere in the sheriff's budget as well. I mean, there has to be correction staff to support these programs as well. But my more important point is that we need to be very clear about how we're funding this program within the jail. We're talking about $1 million budget. And at this point in time, the county executive has tentatively approved the use of opioid settlement funds to continue to fund this program. This is one of the risk areas that I referred to in my introductory remarks. We have those funds now in two different pots of monies for opioid settlement funds. But after this next year, we're talking about a yearly stream of money that will not pay for medication-assisted treatment. Moving forward into 2025, we will have to be thinking about some other things. My hope would be that there would be some funding from the state or the feds to help offset the cost of these programs. And an example of that is the feds have now approved for the states, New York State isn't one of them quite yet, to allow the use of Medicaid funds to help with medical costs and or substance abuse treatment within jails within individual states. New York State has not made that move quite yet. My hope would be they would, at the very least, allow for a 90-day look back with Medicaid. The vast majority of our incarcerated individuals are there only weeks. If we're able to do a 90-day look back with Medicaid, we would really be supportive of that, to be able to use those dollars that are already allocated for medical expenses. So, within our state and within our country. So, that we may be looking at a possibility for that, those to offset those costs in 2025. But that remains to be seen. But
Sam, looking at the separation of the math program from the jail clinic, we can see where the expenses were transferred over, and we can see where the one revenue line, sale of property compensation, was transferred over. But help us understand why the shared services revenue went away. The state aid was reduced by $100,000, and the federal aid went away.
So the revenue some of that came from the sheriff, some of it came from mental hygiene. When we went through the budget process looking for revenue streams for the program, those were not available going into next year.
I can help with that question as well. So the opioid, in 2023, there were several revenue streams that were available, grants and such that were available in 2023. So we looked at all the revenues that were used this year, and if any of them, such as opioid settlement funds, were not fully used in this year, we are able to reappropriate them, so to speak, in the 2024 budget. So the other revenues that don't show up in 2024 are those ones that were only available in 2023. So in a sense, we use the opioid funds last in 2023 to offset the 2023 expenses, because those other funds were only available in 2023.
Thank you.
So this year, the total revenue for the MAP program is coming from what source?
There were a couple different drivers. There was an OASIS grant. There was one through the sheriff, the COSAP grant. Those have actually we've been kind of paying the expenses out of the program and then doing kind of a fake invoice to mental hygiene to recoup all of that. So those funds have all been received at this point, and now we're moving into the opioid settlement funds.
How much of those are we using?
I forget, was the exact number for next year, Kitty, 7?
Some,
We had a projection of rolling kind of like 700,000, I believe, of what was reserved for this year into next year, and then the balance was what was coming from the opioid settlement. And to date, we had spent about 385,000 through the MAP program. Most of that obviously is on medication, since most of the positions had not been filled at this time.
There were, last year, around this time, we had talked about budgeting 6 positions. We currently have 3 of those,
Bill?
an RN, an
Yeah.
LPN, and the ops assistant. Right. So the vast majority of the costs have been medications themselves.
Okay. Any other questions? All right.
All right, so next is environmental health, which is A4090. This department, I do have a typo, because late in the budget process, we did add some ARPA funding in for the lead program, which is in here. So it originally said decreased based on a reduction of the HUD grant, but once we added the 664,000 of the additional ARPA for the lead program, that was very late in the process, so that to get missed, I do apologize. But this had a projection of a lead grant. Last year we had projected using almost 2.2 million. It is still quite a large grant that's left, but the projection this year of what we were going to use was 1.5. So the revenue and expenses were amended or changed for 2024 based on that projected use. We did, as they've discussed, we do have a reallocation of an engineer of a 0.5 FTE. So there is an increase based on that position in this department. And and then the revenue kind of corresponds based on that. And the personal services would be the same based on that increase of an FTE. It's not really an increase, it's a reallocation from elsewhere in public health.
Why the big decrease in equipment?
I was just gonna ask that.
Part of that was through the request, so a lot of the stuff over the years has kind of got lump bucketed into different areas. So I kind of separated it out more into contractual than we have in the past. But that was just going through the requested equipment. And there were some items that I put in operating that weren't in the equipment itself. And a lot of those items in there are IT driven, so a lot of that budget comes from them.
Sam, so for 2024, you're back to roughly the 2022 levels?
Yep.
Roughly? Okay. I had the same question as Marty did.
Our fees for this program have been relatively flat as far as what it costs to obtain permit fees and all that, application fees, those are all, how long have those been current, at their current rate?
They just increased them slightly a year or two ago, really just in keeping up with the cost to cover the services for sending sanitarians out and that type of thing.
Any other questions? Okay.
So next is A2960.ADM. This is the education handicapped children, as we've been saying, disabled children. This is, as Dr. Falk said, taking a look and coming in and seeing where we were budgeting and finishing every year. It didn't make a lot of sense to any of us, so we've basically taken on and budgeted towards the trends that this area and this program has finished at each and every year. Even looking at this year, we have an $11 million budget. We're on pace to finish about 7.5, 7.7. So that's the reason that there's such a large reduction, that's actually driving the large reduction for the health department. But this is also the area that, as we mentioned, does have some risk coming out of COVID, identifying the number of children in placement coming forward. So while we're budgeting based on the actuals of what we're seeing today, there is risk if numbers greatly increase over the next year of this being a problem area.
Just too much unpredictability coming into the school year. We know there are changes and likely increases in contractual costs because of shortages with physical therapists, occupational therapists, speech therapists. So those contractual services and transportation costs have increased tremendously over the last 3 or 4 years. Eye-opening, actually, when Wendy shared those numbers with me. We are trying our best to work with some of the school districts to help take over some of the transportation responsibilities and reduce the contractual expenses there. I think that'll help. So we will continue working with school districts in regards to that. But, you know, in an ideal world, you know, every school would have their own occupational therapist and speech therapist. The reality is that there's a shortage, and those individuals, those professionals have to go from school to school sometimes, or it's difficult.
Or the children, have to be transported to schools with the special classrooms. There are some wins to talk about though too, and to Westfield, and Wendy can talk more to this if I'm not getting this correct, but Westfield recently added a classroom in-house. So, you don't see the transportation costs there, you don't see the additional costs on top of then moving those children throughout the county. So that's a great model that we're hoping other school districts will follow.
There's also been a shortage of drivers too, though. So the school's probably happy to have somebody else take responsibility for that. But you still gotta find the drivers, and
Right.
especially somebody that can handle a child with special needs.
Right.
We only had one bid for transportation this year, so we didn't, as hard as we tried, the only
Yeah.
school district that bid was Westfield. They were doing their own children. But we did write the contract for 1 year, so we can continue to push towards that.
Okay.
We also, they added 5 special classrooms this year, so we could go as high as 500 kids in the specialized, either in a 6-1 or a 12-1, which sometimes they will have aides, which could be 10,000 more on each kid with their tuition in between 29 to 41,000 plus any therapy. And we do have, for the first time that I've seen, 4 kids going to Springville to a specialized classroom, because no classroom in Chautauqua County can handle their issues and behaviors and medical needs.
Yes, it's a very expensive mandated program, but very important work. It's similar to, as Dr. Falk was talking about, the professionals who work in the correctional facilities. Very much the same demands on the professionals that work in this area.
And it is roughly 60% funded between the state and federal government.
Which isn't enough as far as we're concerned.
It's actually through the education department. The funding comes from the education department.
Through the state, though?
Yes.
Okay, so in the funding roughly is 60%, I think.
Close, yes.
Okay. It's an important program, and I agree, there should be more funding from the state and federal government.
Yeah. Just to summarize, when you really look at it for one individual student, we're talking about $40,000 for the services for one student. per
Plus
year, per year.
transportation, plus if they need an aid, could be 10,000 more in aid for the year, and that would be a one-on-one aid, and about 35,000 a year for transportation for that child. Very expensive.
And you indicated that there is risk in this, that there may be more?
just based on the unknown coming out of COVID, how many children are gonna need to be in this program? So there's a lot of variables that we don't have a lot of good data on coming out of COVID, basically. But at the same token, budgeting a $7 million local share, didn't make a lot of sense also to, I mean, I followed a template left behind, and I came up with a contractual number of 12 million using that template. Reality, looking at where we're at, finishing at 7.6 today, that number made more sense based on the data I'm seeing, not a projection of numbers that we're not seeing at this time.
Yeah, as we looked at the numbers, our best guess was, because there can be so much variability in the number of children that participate in this program from year to year, it was almost as if they were planning for as many as they thought might be a part of that program the following year. And so, yeah, Sam's helped us kind of shave that back to a more realistic view of what it actually is. But Wendy's done a wonderful job in preparing all of us and understanding what goes into the program. And so what we're talking about in terms of, you know, why it might look different out of COVID is because these programs, typically the children are assessed, you know, before they enter the school program. So during COVID, a number of those assessments just weren't happening. So there could be a major lag and then a follow-up now of assessing dozens, you know, more children that weren't assessed during that period.
That's, okay, that answers.
Yeah.
Thank you. Anything else? Okay. All right. And the last one we've got is A4059, which is the early intervention program. In looking at this, the changes to the budget and the increase are based on the new CSEA contract. The contractuals are kept flat in this department, and looking even to date information, that makes sense. We're about 60% expensed in early intervention as of today for 2023. So going into next year, it made sense to me at the time of the budget, keeping this flat. With the exception of the changes in the personnel based on the contract. Any questions?
Yes, I have a question.
Yep.
So the therapists that you have working with the early intervention program, how do they get paid? Do they, is there reimbursement from insurance from the families at all, or is it all through the county?
No, so EI is actually, the therapists for the early intervention, which is 0 to 3, are contracted through the state. A few years ago,
Okay.
the state took that over, so they pay for it, they contract the rates. There's pros and cons, they maintain all that, they keep the personnel up. The downside is, there are people saying they'll do care in Chautauqua County, but they live in Broome County, so there's some issues there. But it's contracted through the state, we really don't
So
have
you
a
take
say.
over at age 3, age 4?
Preschool, 3 to 5, we have contracts for, yes.
Which
Some
it
with
tends
school
to be.
districts.
It tends to be a number of the same therapists.
Correct.
Yeah.
Okay.
So they get paychecks from two different.
So they
And
get
for
paid
your
what?
Ford.
They get paychecks from two different
Okay.
entities. Yeah,
From the school and the county,
from the county and the state.
and the state.
Or private, they could do a lot private on the side too.
Mhm.
Because some kids do get insurance covered services as well. Especially if they don't qualify for these services, they will go to insurance sometimes.
Okay. Anything else?
Mark, 3 less FTEs, a 14% decrease in local share. Nice job.
Thank you.
Sam, if I can take you back to education of handicapped children.
Yes.
Can you explain the funding that we receive for that program? Is it a percentage of the costs, or?
We talking preschool or
Yes.
early intervention?
I haven't done any of the claiming on that, but yes, it is a percentage.
So preschool is actually based on a cost that the school system, so if the schools will submit a cost of what it costs to do business for these children. It goes to the state, then the state then sets our rate of reimbursement based on that.
Okay.
So
Roughly,
Because
what is that?
It's,
Not good.
Yeah, yeah, it's not great.
Is it different for each area of each district?
No,
too,
it's-
because of the-
No, I don't think, I don't know that answer for sure.
I guess, I believe it is.
It would have, I think it would have to. be,
Each
just
school
'cause it's-
district has a different rate, so
Sure.
our AVLs are then based on that.
Okay.
But to make that a little more complicated, the transportation side of this also has a rate, but it usually is much higher than the cap. And the state REEF kind of gives you a different number of what you get paid. So although you think you're getting 59.9, you aren't, because it's capped.
Transportation costs are only gonna go up more because of the electric buses.
We're trying our best. We're actually approving some kids to be on a bus a little bit longer, so we can put more kids on the bus that traditionally we would have had an extra bus, which you pay a rate based on a bus or a van. So-
Yeah, and if you think about it with the transportation costs, so you may have, 5 different students living in 5 different districts. So it's not like these 5 students are all in the same district, and so a bus can be contracted to do a loop around the neighborhood and then transport them. So they may be going from, Bemis to Lakewood to Cassadaga and then up to Springville School. So, you can see how the transportation costs, are lofty.
And when they go out of county, the rate, on top of the regular rate for the bus or van, they will get a Medicaid rate of $2.05 per mile extra to transport those kids.
So my question was based on the fact that your total budget looks like we're about a 65% reimbursement of our costs. But if our costs went up by $1, we don't necessarily expect we get 65 cents in funding.
It's traditionally 59.5% reimbursement rate.
Okay. But there are caps and other
There's
factors
caps
that
and-
would influence that as well. Okay,
Yeah.
thank you.
Okay, anything else? Okay. Thank you very much. Thanks for coming early.
Do y'all get to get outside at all today? Get some fresh air out there? Take a break. We'll stretch our legs for you. You can vicariously live through us as we walk back.
I already do that.
What was that?
I already vicariously.
It's nicer outside than it is in here.
Well, we appreciate all the work you all do on behalf of the community too. You guys, you're appreciated.
You've been here today more than we have. Lacey, you're a breath of fresh air now. This is fun. So like James said,
Thank you.
Yes, I've just been contacting the doctor, and they said bring him in. I'm sorry.
Want to see if they want to go through
Well, yeah, the answer is, he's.
The discussion.
Safety net.
Good, how are you?
So that's fine. I forgot Dan is Human Services, Jamie and myself.
I can wait.
No, I mean, that's fine. So,
probably want to go back through the amendments.
okay, so if we can have, continue our discussions on safety net and the,
Mental hygiene law.
mental hygiene law. And you were, let's do those first. Elizabeth may have to leave here shortly, so.
Sure.
Where are we? So what do you guys, on safety net?
Marty, I think that needs to be increased. I don't think that's realistic. What figure it needs to be increased to, I'm not sure. But I think it does need to be increased. And I think it should be out of your committee, before it gets out of control.
Right.
Realistically, I think they're looking at, I kind of estimated 1.5. Over, that's what I'm thinking, without Ben and I know it's only 500 now, but I mean, it's. Budgeted 500. We're spent over $1 million.
No, I think we're talking safety net.
Safety net is the first one.
First
Oh, safety, okay.
Yeah. They were predicting a $2 million shortfall
For this year.
for this year. For safety net.
So as a reminder, if they were, talking about if we were going to be looking at pre-pandemic levels, the local share for 2018 was 4.8 million, and in 2019, it was 4.7 million. The 2024 local share is 3.6 million. So, a little more than a $1 million increase. It is an area that will, fluctuate year to year. I mean, it's often an area where we do have a lot of discussion on because it can be hard to predict. But there's a couple of approaches you could take is to consider increasing the full amount that if you wanted to assume like the 2018 or 2019 level, consider that we may or may not reach that level next year, but maybe it would be prudent to assume that at least half as much more in 2024, realizing that if it looks like it's trending higher, we'll have to amend the budget during 2024, and further, if it persists, that the 2025 budget would then need to have another incremental increase.
If working through, if we needed to come up with money for next year, where would we look? If we under budgeted it, where would we be looking, and can we look there higher, is my point. So how conservative are we in certain areas? Could we increase those a little along with it?
There's throughout if you're looking at it across all county departments, I don't see any areas to decrease to this magnitude. So I think you would need to consider either the use of fund balance and or increase, exceeding the property tax cap.
Sales tax revenue and the loss.
So if later in the year they're exceeding their budget and they come back to us, we would take it from fund balance because we've already set the budget below the tax cap, right?
Yeah, so if there were no other areas where the budget could be amended, so let's say, we're halfway through the year next year and safety net is trending to exceed the budget. If we know of a surplus elsewhere in the budget, we could offset it with that. But that's an unknown. Otherwise, yes, you could utilize fund balance to offset the difference at that time.
So if they don't fill those 25 vacant positions and all of that salary and fringe remains in the budget unspent,
That's where we have already included a vacancy savings in the department budgets.
but only a 5%, right?
Correct, but however, if you want, there's some departments where they would also have revenue associated with positions, so to the extent we're not filling the positions, we would not have that revenue. Now, we did budget for a 5% vacancy savings, though we have been trending at 10%. The reason we used 5% in part was because we knew in some areas we would not realize the revenue either, so it kind of was a break even to use a 5% vacancy savings.
Okay.
So 5% across the board.
Yes. Yeah, so some departments will realize more and some less, and so we will have to monitor the budget throughout next year to make adjustments as needed.
So taking that vacancy savings into consideration, obviously, it does, again, make 2024 a much tighter budget than our, current year and even previous years, budgets have been. We don't have quite as much wiggle room. And, I mean, in a lot of cases, there are times where .4s could also be used, because sometimes you'll see a savings there, but I will say that department heads really minimized any .4 increases. I believe that in the AD and DM funds, I think that the total was roughly about $100,000 worth of an increase in .4s, and that was it. So they really kept their increases very tight, very minimal, very reasonable, but obviously that doesn't fare well if you're looking for a little bit of wiggle room for coverage.
And Kitty, the legislature has been pleasantly accustomed over the last couple of years to see that we have had budget surpluses each year. What is your expectation for the budget performance for 2023, for this year?
Right now, I mean, I'll just say in one area that does, in the past couple of years where we have seen a significant surplus is sales tax. So the good news is it's trending right on budget for the most part, so, it's not under budget. I at this point expect to make our sales tax budget, but we're not gonna have a $3 million or more surplus in sales tax, as we have in the past couple of years. Based on my notes today, a couple of comments that were made, I noted about net of 1.5 million shortfall in the budget, between the safety net trending $2 million higher. Then there's another resolution I think you'll be seeing this month that would reduce the use of fund balance by like $470,000. So right there's a net of $1.5 million over budget. Now we are trending again behind in our personnel costs, so without getting into a lot of detail, which we've been trying to get to, but getting the budget out kind of got in the way. But it is on my mind to kind of dive a little deeper in our current year variances. But my general prediction is we're going to come pretty close to on budget this year. I'm not anticipating any significant surpluses.
Thank you.
Just in this current, the handicapped children, for instance, we were able to save a pretty significant share from this year's budget. Where did that money go in this year's budget?
Not sure I'm following your question. Let me get to that page.
Well, the health department in general, how much was there, you said it decreased how much percentage?
1.2.
Yeah, where did the rest of where did that 14% savings go? Where else was it distributed
In the 2024 budget, because theirs was a decrease, well, it helped offset expenses, across all county departments. I mean, we had a $3.5 million increase in Medicaid expenses alone. So the biggest cost increases were, Medicaid, the indigent legal services 18B rate increase, that was about $1 million overall budget increase, and then the aside from that, it's personnel costs. So personnel costs have gone up, though we did a really good job to minimize the number of FTEs increase in the budget. But I would add, for your consideration, that I don't think it's unjustified to exceed the tax cap. I think from my position where I sit, it would be a responsible thing to increase the budget to the level of recurring expenses that we have. And if we do truly see these as, recurring expenses, as much as we've been really successful in staying under the tax cap since it was implemented, but at the same time, and even just since we set the tentative budget, a couple of new things have come to light, that, Medicaid additional increase when we got the final rate, so, things do change, and,
Didn't one of our presenters indicate, though, that if we went over the tax cap, that their reimbursement was going to be cut? Wouldn't that negatively impact the budget as well?
Yeah, and Pierre had already asked me if we would get that figure. However, we did in the past, in 2021, we did exceed the tax cap. And there is a waiver process for Raise the Age to submit a waiver, so that, and we were approved for that waiver, and we did get the reimbursement for Raise the Age. But it is a concern, so we, I don't know how often they give out those waivers. We, it was kind of right in, in the middle of the pandemic, so they may have been more lenient, but, we're gonna get that information as to what that revenue impact could be.
So I guess bringing it back to our safety net, what should we consider doing to safety net? I think a raise is important. What number are we thinking?
Do you have any thoughts?
I mean, and they said 2,000, I was trying to write really fast, but like 7.8, 7.5, and 6.4, and we're only going up to 6, which is $500,000 more. And last year they spent 6.6, or 22 they spent 6.6. I don't know. I think another million?
I was kind of thinking 500,000.
Even if we split that like 750.
750, there we go.
750 over the 500,000 that we already have in here as an increase. So increase 1.25.
Gets us more realistically, is anyone else have that?
The only thing is, what if we get through the budget year and there's room in the budget to move it from somewhere else? I would hate to jeopardize either the tax cap or the budget by increasing it when there might be funds available. And if there's not funds available, am I right in saying it would just come from the fund balance?
Yes, I mean, that's a true statement, yes. It may be that, in terms of where we are in the budget hearings, your committee could recommend what you think as the increase. We still have a couple of more days and other departments to go through. I'm not anticipating where we would find that big of an offset, but, should we, new information, it happens, new information comes up, but it could be something that we can further deliberate on, as we get to the end of the week.
And bear in mind that for every dollar you increase the expense, you get 29 cents in revenue to offset it. So $1 million increase would not be $1 million net, it would be 700,000.
And I guess into consideration is our next one, we need to reach that too.
Yeah.
For the sending individuals up to treatment themselves, and that one we know is under a pretty significant amount. So, into consideration, we need to increase them all, and I guess there's a number we should.
An overall number between the two?
I do them one at a time.
One at a time, but I'm just saying that.
See where you're at.
Yeah,
But to Katie's point, I'm not sure if we should just come up with a recommendation instead of an actual proposal.
I was thinking 750 then.
Well, okay, now, what do you think they need, Marty? Do you think realistically, they should have $1 million? Is that what we're thinking? Well, I wouldn't go $1 million because, I think they should have come in with a realistic budget. They did. Even if we increase it by 500,000, I mean, that's still a lot. I mean, they should have looked at this and said, look, this is the way we're trending. And they should have come in with a higher budget. So I guess I'm with I think I'd go with a lower amount in like you mentioned. If they exceed that next year, let them try to make it up out of their 2024 budget. If they can't, then we will have to go to fund balance. But at least, let them try to make up some of that shortfall, which they should have projected here today.
Right.
Mr. Chairman.
But to Pierre's point, we get reimbursed 29%, so.
Well, okay.
If we do go 750, it's more like
550 or
550 or something.
I think your amendment could be what net local share effect do you want it to be, and then we can go to the department and ask them more specifically, what would the expense be and what would the revenue be in order to increase the local share to what you want the net local share increase to be.
I like that. It bothers me, like you said, Terry, that they didn't come with a different number the more we think about it, but it's tough just to say, but probably likely we're going back to the pre-pandemic number, but how quickly we get there is part of the problem. So they might be guessing as much as we are, but they should be better prepared to look at the trends and think about where it's going, how much money are they losing, and what the difference is going to be. If we do the 750, take away the 29 cents, I guess I'd feel okay with that. I don't want to start out saying we're going to take money from the fund balance.
Are we saying 750 over the 500 that they're already asking for, or 750 total?
750 total.
So 250 more.
Oh, no.
It's additional, isn't it?
Additional to 500, so 1.25.
Yeah.
Over their 2023.
Are you talking about the expense right now? So you're proposing, are you ultimately going to propose a change to the expense and the revenue so that you get to a net local share effect that you're seeking?
I think it's what you suggested is a much better idea, because I don't think we have the calculating ability to do that math. So I think we want to go to the net share. Do you agree?
So right now, the net local share for safety net is $3,638,000. The 2018 and 2019 local share was 4.8 and 4.7. So if you want to increase the local share by $1 million, we can get for you the expense and revenue adjustments to end up with a net local share increase of $1 million or whatever other net local share figure you want.
But that's to the expense.
Well, we were talking expenses, but.
Expenses.
So I agree with Katie.
Okay.
I don't know if they do, but I do.
So I think if your committee wants to propose amendment to increase the net local share for safety net by a dollar amount, by the end of the week, we will ask the department to give us the specific expense and revenue figures to have that result.
So if you increase the expenses an additional 750,000, and 29% of that gets reimbursed, your local share increase would be $532,500.
And that would at like 4.1.
Yeah, roughly 4.1, yes.
And that's about 700,000 less than what it was back then. So
Correct.
hopefully we're anticipating that, hopefully we're at least meeting them halfway, I guess. If hopefully we stay within it, if we don't, we can come up with it in the budget,
I'm comfortable with that. And could you repeat that net number?
Yes. Net local share increase would be $532,500.
What does that equate to for the appropriation?
I'm sorry?
What does that equate to for the expense?
Total expense increase of an additional 750,000. Yep.
Over the 600, or I'm sorry, over the 6 million?
Yes.
So 6 million, it should be changed to 6,750,000.
Right. For the appropriations. Kitty?
I just wanted to, comment on the department's preparedness. In Sam's defense, Sam transferred over to his current position at, right in the middle of the budget development. He was doing the all of DPF's budget, along with learning, social services, the biggest county department, public health. And so, while I believe he's done a really great job, he's still learning in his position. He did bring forward today the most recent projections that he had not had available at the time he was preparing the tentative budget. So, I was glad that he brought the most recent information today that he didn't have at the time the tentative budget was available.
Kitty, did you discuss the safety net issue with him in the budget procedure?
We did, and then from his remarks today, he since then has researched it further, and the very most recent information is trending higher. But the bottom line is he's juggling quite a bit. I mean, between DPF, social services, and public health, I mean, that's almost half the whole budget. So.
He's got 3 different hats.
Yeah.
I just wondered if he had discussed that with the finance department during the budget procedure. It sounds like he had.
Yes, and we did increase the budget 500.
Yeah, all the figures apparently, when he discussed the safety net figures with you guys. Okay.
So on the flip side, really quickly if you're making notes in your budget books, on the expense side, you would increase that to 6.75. On the revenue side, you would add 217,500 to their revenue. So that's the 29% of that 750,000.
217,500.
Correct. Add 217,500 to that total.
217,500.
Yes.
You have a motion for that? To amend? We need a motion for that?
We're ready to do that now? We're not going to wait till the end of the week?
No, we have to recommend it to audit and control.
Okay. I so move that we increase the expenses for safety net to $6,750,000 for the 2024 tentative budget.
Okay, second?
Second.
All in favor?
Aye.
Opposed? Okay, carries. Okay, now for mental health law. Where are we? And that's mental hygiene, correct?
We had the different tabs. I don't know.
4322.
It's in. I was in 31, right?
30, where's mental health law, 33?
33, yeah.
33.
It is 33.
4322.
There's summary sheets, though, were under the 3132 Human Services tab, if you're looking for the summary sheet rather than the line item.
Here it is. Got it. It's behind,
Safety.
Social services, okay.
okay, so they are,
So he thought that he was gonna be more closer to 1.2 this year.
Mm-hmm. This is slightly over a million, yeah.
We're budgeting 500,000.
We're budgeting 500, which is an increase of 250. But we think we're gonna be closer to 1.2. Any thoughts on where we should be at with that?
Didn't he say he was projecting over $1 million?
Right. I wrote down slightly over a million, Dan, it's at 1.2-ish.
Yeah, he didn't really know, but it was already. I just heard over a number.
Over a million.
Over $1 million? He didn't have any points. I'm just
No, I know.
clarifying. He didn't say 1.2 or, he just said that we're going over $1 million, is what I heard.
We-
Because what it taught me was, we're going over $1 million, so let's, and I'm not throwing Sam under the bus, let's budget 500,000.
Sam doesn't, do the mental hygiene.
Oh,
Yeah,
yeah,
it's
I'm
Paul.
sorry.
Who was 3 days,
Sitting there the whole.
3 days old?
Yeah, I'm not, it was just.
No, I know.
It was an
It
interesting
was just, right.
observation.
Any thoughts on where we need to be on that?
Well, it's hard because this is, we have to do it, and we have to pay for them.
Yeah.
If he thinks that's where we're
At least
gonna,
250,000,
Yeah.
at least.
if he thinks that's where we're gonna end up, we could do the same similar kind of thing, come in a little under, like you said, add 250 maybe, and
And there's no reimbursement, so it's 250 is 250.
right.
500 is 500.
As far as our 2022 actual expense was 881,000. I know we are trending, $1 million or more this year. Prior years, I know there was a change since then, but they were, between $150,000 and $270,000 in the years 2019 through 2021.
And there's a resolution coming forth to increase?
For this year's budget, yes.
Where have all the increases come from this year?
What do you
Where, how have we covered it this year?
Different department.
Yeah, within the department or general fund, or where have the transactions come from this year? This year we budgeted 250,000, and we spent 881, we're gonna spend another whatever. Where have we taken that money from to put into this?
Do you mean where, when we budgeted for 2023?
Yeah. How have we paid for it this year? I mean,
It was part of the tax levy essentially, yeah.
Which this year we don't expect that we are going to be able to cover much else, right?
We included, essentially we included the $250,000 increase from 23 to 24 is inclusive of the net property tax levy.
But I think he's asking where the extra 600,000 came from. Did we take it out of fund balance?
Did we pay for it?
The resolution is coming this month, you'll see it, so we'll be proposing to use fund balance, yes.
And that's what we've used.
Yes, in the past, yes.
It's all fund balance.
The full amount.
In the resolution that is coming this month, it's in my list to approve, but I think the full amount would be proposed to use fund balance because there's not any other significant shortfalls to offset that expense. No, the 2022 actual was 881.
Up to this date. and there's another one coming, and we only budgeted 250.
It-
So all the extras come out of the general fund, is what we're asking.
Yeah.
Yeah.
So what's that amount? Do we have that?
Trending towards over $1 million.
I thought they had it in here.
proposing 600,000.
I know they had been working on a resolution. Let me see if I can.
They even said the resolution was going to be short $75,000 of what they've already spent. So there's another resolution to come after that.
Well, and he said, well, yeah, and he said that he's already at probably spending 575, is what he said next year.
Yeah.
And he's only got 500 now, so must be there's more people in the program.
Well, yeah,
So the point on this one is we, you know, we're gonna be using general fund probably next year to offset, not within its own budget, you know, and that's the point too. There isn't gonna be money from within the department, it's gonna be general fund.
So it almost doesn't.
So we're short like 350,000 plus.
Yeah, at least.
So then we.
And there's no revenue.
Say amend it to $1 million.
An additional 500,000.
Yes.
Make a motion.
I'd like to make a motion that we amend it to $1 million, additional 500,000.
But they're not going to go that high this year, are they?
They're gonna be over $1 million this year.
This year,
Yeah.
They're already gonna be.
Oh, okay.
trending towards that.
I'll second it.
Second. All in favor?
Aye.
Opposed? Okay.
So just as an aside, you know, you did already pass the amendment for the Medicaid, which Jennifer had identified other offsets in other committees. I don't know if you want to hear those, or we'll be going over them with the other committees and with audit and control by the end of the week, so.
Is our resolution subject to the approval of those other funds being available?
The Medicaid, well, so at the end of the week, typically in the Audit and Control Committee hearing, they will be reviewing all of the proposed amendments from the week, and, you know, maybe bringing back department heads for further questions. And so all the final adjustments are done then.
Okay.
And then they'll still be reviewed in committee, in the regular committee meetings this month.
Thank you.
But those are through, the Medicaid adjustments come from other departments all across the county.
Yes, I mean, most significantly, there was a reduction in the salt cost that we've, the salt rates came out after the tentative budget was prepared, and that created a significant change, and a few other things. Those other things are known items that we know will be and can be reduced. They're not questionable items.
So what has this done to our tax rate and our cap? The adjustments today?
Well, basically $1 million over the tax cap at this point, you know, between the mental hygiene law increase and the safety net increase.
So we're PJ budget, were we right there?
Yep.
We weren't hundreds of thousands.
$919 below.
Remember, we were told if we had money, we gotta find someplace to get it.
Well, you had the biggest challenges, I would say, from the departments today. I mean, you know, the other departments, I'm not aware of any other as significant items.
We'll see. Kitty, so roughly, every $100,000 increase in appropriations, 1% extra in the tax rate, roughly?
From that overview, I think she handed out the overview that had the figures on it. Yeah, we'll get you the general figure, but yeah, I mean, the tax rate this year is kind of an anomaly because the assessments went up so high.
I understand.
Yeah, so.
But somehow we can figure out roughly every $100,000
Yes.
increase in appropriations is equal to a penny or 1.2.
$89,295 equals 1 cent change in the rate.
What is it?
$89,295.
89,000.
So
It's on the
we're up-
summary sheet.
So we brought it up to 7. Brought it up to 7,000.
That may be the amount from last year, but we'll confirm that figure for you.
$89,295.63.
Just for clarification, that figure on there might be.
The 63 cents.
We'll confirm in tomorrow's budget hearing with admin services.
Where do I sit tomorrow?
Right here, Bob. Okay.
Do we have to amend, or do we have to adjourn?
Lower someone's budget by $1, say that we came up with something. We could amend someone's budget by $1. I'll make a motion to adjourn.
Second.
All in favor?